The National Electrical Code, specifically Article 517, addresses the electrical requirements for healthcare facilities. One critical aspect is the provision of backup power systems to ensure the continuity of essential electrical services during power outages. The code mandates stricter backup power requirements for facilities where specific types of medical procedures are performed. The question at hand revolves around defining what constitutes an invasive procedure, particularly in the context of a doctor's office. If a doctor's office performs invasive procedures, it is then treated as a hospital from an electrical standpoint, necessitating comprehensive backup power systems. Heart catheterization is cited as an example of an invasive procedure that would trigger these heightened requirements. However, the question arises whether endoscopy, which involves inserting a camera into an orifice without breaking the skin, also qualifies as an invasive procedure from a legal and regulatory perspective. The challenge is that the provided text does not offer a clear definition of what constitutes an invasive procedure. Without a precise definition, it becomes difficult to determine definitively whether endoscopy falls under this category. To accurately determine whether a specific procedure like endoscopy is considered invasive, several factors must be considered. Firstly, regulatory definitions play a crucial role. Legal and medical regulatory bodies at the state and federal levels may have specific definitions of invasive procedures that are relevant to the application of electrical codes and backup power requirements. These definitions may vary depending on the jurisdiction. Secondly, medical standards of practice provide guidance. Established medical guidelines and protocols often classify procedures based on their level of invasiveness, considering factors such as the risk of complications, the depth of penetration into the body, and the potential for disruption of normal physiological functions. Consulting with medical professionals and reviewing relevant medical literature can help determine how a procedure is typically classified. Thirdly, risk assessment is essential. Conducting a thorough risk assessment of the potential consequences of power failures during different types of medical procedures is crucial. This assessment should consider the potential impact on patient safety, the availability of alternative power sources, and the time required to restore power. The results of the risk assessment can inform decisions about the appropriate level of backup power protection for different types of procedures. In the absence of a clear definition of invasive procedure in the provided text, it is necessary to consult relevant regulatory codes, medical standards of practice, and conduct a thorough risk assessment. This multifaceted approach will help determine whether a procedure like endoscopy triggers the heightened backup power requirements outlined in Article 517 of the National Electrical Code. The NEC, or National Electrical Code, provides guidance on the installation of electrical wiring and equipment in buildings. Article 517 specifically addresses healthcare facilities and outlines requirements for essential electrical systems, including backup power. The NEC doesn't define medical terms. Instead, it references other industry standards and regulations. The key to understanding backup power requirements in a doctor's office performing procedures lies in identifying what constitutes an essential electrical system. Essential electrical systems are categorized into different types, each with varying levels of backup power requirements. Type 1 essential electrical systems are those that are critical for life safety and patient care. These systems must have automatic transfer switches and generator backup to ensure continuous power during outages. Type 2 essential electrical systems are less critical but still important for supporting healthcare operations. These systems may have less stringent backup power requirements. The specific type of essential electrical system required for a doctor's office depends on the nature of the procedures performed and the potential impact of power outages on patient safety. For procedures considered invasive, where a power interruption could pose an immediate threat to a patient's life or well-being, a Type 1 essential electrical system with full generator backup is typically required. The decision of whether a procedure is invasive is made by local authorities, medical staff, and the authority having jurisdiction, or AHA. AHA makes sure all rules are followed and the installation is safe. The specific requirements for backup power systems in healthcare facilities are outlined in the NEC and other relevant standards, such as NFPA 99, which covers Healthcare Facilities Code. These standards specify the size and capacity of generators, the type of transfer switches required, and the testing and maintenance procedures necessary to ensure reliable operation. Compliance with these standards is essential for ensuring patient safety and maintaining accreditation. In the context of the question, the key determination is whether endoscopy is considered an invasive procedure that would require a Type 1 essential electrical system with full generator backup. This determination should be made in consultation with medical professionals, regulatory agencies, and the authority having jurisdiction. If endoscopy is deemed to be an invasive procedure, then the doctor's office would be subject to the same backup power requirements as a hospital, as stipulated in Article 517 of the National Electrical Code. If a procedure is deemed to be invasive, then one must consider the generator. A generator for backup power systems in healthcare facilities must meet specific requirements to ensure reliable operation during power outages. Firstly, the generator must be sized appropriately to handle the load of the essential electrical system. This requires a thorough assessment of the power requirements of all critical equipment and systems that will be connected to the generator. Secondly, the generator must be equipped with an automatic transfer switch, or ATS, that automatically switches the load from the normal power source to the generator in the event of a power failure. The ATS must be reliable and capable of transferring the load quickly to minimize disruption. Thirdly, the generator must be tested regularly to ensure that it is functioning properly. Testing should include both routine maintenance checks and full load tests to simulate actual power outage conditions. Fourthly, the generator must be located in a secure and well-ventilated area. The location should be protected from flooding, fire, and other hazards. Additionally, the area should be adequately ventilated to prevent overheating. Fifthly, the generator must comply with all applicable environmental regulations. This includes regulations related to emissions, noise levels, and fuel storage. Selection of a generator for a healthcare facility should be based on a careful evaluation of these factors. It is important to choose a generator that is reliable, efficient, and compliant with all applicable standards and regulations. The design and installation of backup power systems in healthcare facilities should be performed by qualified electrical engineers and contractors who are experienced in healthcare electrical systems. These professionals can ensure that the system meets all applicable requirements and is installed safely and correctly. In addition to generators, other components of backup power systems in healthcare facilities include batteries, inverters, and uninterruptible power supplies, or UPSs. Batteries provide a source of power for a limited time during power outages. Inverters convert direct current, or DC, power from batteries to alternating current, or AC, power. UPS provide a continuous source of power by using batteries to bridge the gap between the normal power source and the generator. The selection of these components should be based on the specific requirements of the facility and the types of equipment being powered. UPS are important because some equipment may be very sensitive to a sudden power loss. UPS and batteries are meant to provide temporary power until the generator can come online. Regular maintenance is also important. Backup power systems in healthcare facilities require regular maintenance to ensure reliable operation. Maintenance should include routine checks of generators, transfer switches, batteries, and other components. Additionally, the system should be tested regularly to verify that it is functioning properly. Maintenance and testing should be performed by qualified personnel who are trained in healthcare electrical systems. Record keeping is also essential for tracking maintenance activities and identifying potential problems. Accurate and complete records can help ensure that the system is properly maintained and that any issues are addressed promptly. The National Electrical Code, or NEC, provides guidance on the installation and maintenance of backup power systems in healthcare facilities. Article 517 of the NEC specifically addresses healthcare facilities and outlines requirements for essential electrical systems. Compliance with the NEC is essential for ensuring patient safety and maintaining accreditation. In the context of the question, the key determination is whether endoscopy is considered an invasive procedure that would require a Type 1 essential electrical system with full generator backup. This determination should be made in consultation with medical professionals, regulatory agencies, and the authority having jurisdiction. If endoscopy is deemed to be an invasive procedure, then the doctor's office would be subject to the same backup power requirements as a hospital, as stipulated in Article 517 of the National Electrical Code. The NEC is updated every 3 years, so it is important to follow the most recent edition. It is also important to consult with local authorities and regulatory agencies to ensure compliance with all applicable codes and regulations. The design, installation, and maintenance of backup power systems in healthcare facilities should be performed by qualified professionals who are experienced in healthcare electrical systems. These professionals can ensure that the system meets all applicable requirements and is installed safely and correctly. Understanding the requirements for backup power systems in healthcare facilities is essential for ensuring patient safety and maintaining accreditation. By following the guidelines outlined in the NEC and other relevant standards, healthcare facilities can ensure that their electrical systems are reliable and capable of providing continuous power during power outages. In summary, firstly, the nature of the medical procedures performed in a doctor's office determines the requirement for backup power. Secondly, invasive procedures typically necessitate a more robust backup power system, similar to that of a hospital. Thirdly, endoscopy, while not involving skin incision, presents a question regarding its classification as an invasive procedure. And fourthly, the classification depends on regulatory definitions, medical standards, and risk assessment. It is important to consult with the local authority having jurisdiction, or OJ, which is responsible for interpreting and enforcing the NEC. The AHA may have specific guidelines or interpretations regarding what constitutes an invasive procedure in their jurisdiction. Consulting with the AHA early in the planning process can help ensure that the electrical system design meets all applicable requirements. In addition to the NEC, other relevant standards and guidelines may provide further clarification on backup power requirements for healthcare facilities. NFPA 99 Healthcare Facilities Code provides comprehensive requirements for electrical systems in healthcare facilities, including backup power. IEE 1100, Recommended Practice for Powering and Grounding Electronic Equipment, provides guidance on power quality and grounding in healthcare facilities. Consulting these standards and guidelines can help ensure that the electrical system is designed and installed to meet the specific needs of the facility. In some cases, a doctor's office may choose to exceed the minimum requirements of the NEC and other applicable standards. This may be done to provide an extra margin of safety or to accommodate future expansion. For example, a doctor's office may choose to install a larger generator than is required by the NEC or to provide backup power for non-essential equipment. The decision to exceed the minimum requirements should be based on a careful assessment of the risks and benefits. The electrical system design should be documented thoroughly. This documentation should include detailed drawings, specifications, and calculations. The documentation should be kept up to date and readily available for reference. Proper documentation is essential for ensuring that the electrical system is installed correctly and that it can be maintained properly over time. Regular inspections of the electrical system should be performed to identify any potential problems. Inspections should be performed by qualified personnel who are trained in healthcare electrical systems. Any problems that are identified should be addressed promptly to prevent them from escalating into more serious issues. Training for healthcare staff on the operation and maintenance of the electrical system is important. Staff should be trained on how to respond to power outages and how to operate backup power equipment. Training should be provided on a regular basis to ensure that staff are up to date on the latest procedures. A comprehensive electrical safety program should be implemented to protect patients and staff from electrical hazards. The program should include procedures for identifying and mitigating electrical hazards, as well as training on electrical safety practices. In addition to the technical aspects of backup power systems, it is also important to consider the human factors. The design of the electrical system should take into account the needs of patients and staff. The system should be easy to operate and maintain, and it should be designed to minimize the risk of human error. Communication is essential during power outages. Patients and staff should be kept informed of the situation and the steps that are being taken to restore power. Clear and concise communication can help to reduce anxiety and maintain order. Contingency planning is essential for dealing with power outages. A contingency plan should be developed that outlines the steps that will be taken to ensure patient safety and maintain essential services during a power outage. The contingency plan should be practiced regularly to ensure that staff are familiar with the procedures. Furthermore, the electrical system design should be flexible enough to accommodate future changes in the doctor's office. The system should be able to be easily expanded or modified to meet new needs. The electrical system should be designed to be energy efficient. Energy efficient equipment and practices can help to reduce the operating costs of the system and minimize its environmental impact.